Hi everyone. Thank you for your encouragement and support. Today we are learning a very crucial, important topic in management of respiratory diseases, how to use inhalers. Whenever I discussing asthma treatment, there are three main pillars are one is inhaler medications, lifestyle modifications like yoga therapies, exercises, and diet control to prevent asthma triggers. Third, environmental control, control of indoor and outdoor pollutions, and house dust mite control. Among these, inhaler medications are very crucial. As we come across in day-to-day OPD practices, we have prescribed a good medications with the spacers, but patient doesn't know how to use it correctly. That will completely reduces the effectiveness of the inhaler medications, leads to uncontrolled asthma symptoms and frequent asthma exacerbations. Today we are demoing inhalers, metered dose inhalers with the spacers. It may be a DPI with a rotahalers. When using metered dose inhalers, make sure it's within expiry period and it's have opened recently. We have prescribed medications for asthma symptoms. It's get cured within 5 days or 10 days. Patient doesn't use for 6 to 8 months. When they get asthma symptoms after 8 months, they use the same inhalers that will decreases the effectiveness of the medications. We prefer within 1 month it has been opened. Attach MDI to the spacer. Sit uprightly, take a deep inspiration, exhale completely with the pursed lips. Many patients, whenever they expire, they take a deep inspiration. Don't do that. Expiration has to be done completely. After expiration, keep it in your mouth, seal your lips, take a deep inspiration once pressed, immediately. Hold it for 10 seconds. Some patients, they can do easily 10 seconds. Those patients has an exacerbations are children or elderly people, they are unable to do so. The main motto is if you hold the breath, drug will settle in your lungs. Don't take it out. Completely expiration has to do through the nose and repeat inspiration again without pressing again. So after 2-3 times, according to our dose prescriptions, we can repeat the cycles. Asthma medications has two main types. One is maintenance medication and reliever medications. Reliever medications, as name it says, whenever you have the symptoms, you are taking that. Maintenance medications is prescribed for a specified period. Don't stop in between. If you stop in between, the inflammation in your lungs doesn't improve. That will lead to recurrent asthma exacerbations or attacks. Along with metered dose inhalers, we have other devices like dry powder inhalers, Synco Breathe, which is synchronize your breath. The technique is saying after the deep exhalations, you have to take inspirations calmly. Never take a jet breath. Like, if you take like that, most of the drug will deposit in your mouth and throat, doesn't reach where it has to go. That increases the local effects, local side effects. Most important is, after using the inhalers, rinse your mouth or gargle with a clean water immediately. That will take out the particles deposit in mouth and throat, prevent the local side effects. Very common with inhalers like sore throat, voice changes, taste changes. So never forget gargling after use it. Thank you.